Hi, it's a great pleasure to join you here today in Sharjah, even if it is electronically, to celebrate the International Day of Older Persons. I'd like to talk with you a little bit about our World Report on Ageing and Health. Populations around the world are ageing faster than ever before, and this is occurring in places that often surprises people. So this is a figure of the world today looking at the proportion of the population in each country over the age of 60 years. And what you can see is only one country in the world, Japan, has more than 30% of their population over that age. As we move forward through the century, you see that changes very dramatically. By the middle of the century, many countries have a similar population structure to that of Japan today, and they include places like Iran, Thailand, and Chile. Now, when people consider what this means, they often divide the population into two arbitrary categories. People over the age of 60 or people under the age of 60, and there you might think of the people who are in traditional working ages or children. If we look at Japan and see what these changes mean for the whole of society, let's look between 1950 and 2050 and see what happens. This is a very different world, and you can see there are many more older people than they were in the last century. And when people look at this figure, they often think in a sense that this is a tsunami of older people and it presents problems for society. But in fact, this figure has many flaws. First of all, many of the people who are in traditional working ages are not actually in the workforce. And secondly, it's only a very small proportion of older people who actually require care and support. And if you look at the number of people in the population at different ages, you can see that this is a very different way of looking at things. And so for the World Report on Ageing and Health, what WHO has done is to remove this artificial difference entirely and think about life and the life course as a continuum. Where there are some people at all ages who may be very robust and healthy, and others who may require some care and support. This is actually quite consistent with the way older people themselves are thinking about their lives. So if today we can think we have an extra 20 years to live than we may have had 50 years ago, what often happens is people have thought about that as just being added to the end of life. And because in many countries that's a period when we were traditionally retired, people then think of those extra years as just an extra 20 years of retirement. But older people in many countries are actually starting to think there's a better way of doing that. A better way that would put those extra years in other parts of life. So earlier in life they may take some time to travel or take some more time out to spend with their families. Perhaps at 50 they might go retrain to have a different career, and they may decide to work in older age. The opportunities and flexibility is really unlimited. But this is very dependent on one key factor: health. If people can retain their health into older age, then the opportunities that are available to them are unlimited. If they lose their health, they're much more constrained. Unfortunately, one of the things the World Report identifies is that while we have very good evidence that people are living longer, there's only very little evidence to suggest that those extra years are in any better health than was the experience of the generations before. And so a public health response to population ageing is absolutely fundamental. Now, where do you start? Well, the first place you need to start is to break down many of the misconceptions that currently are very widespread around population ageing. The first is the idea that there is a typical older person. There are many 80-year-olds today who retain very robust health and are active participants in society. But there are many other people at younger ages who require considerable care and support. So this diversity is one of the hallmarks of older age. And as we frame a public health response to older populations, we need to make sure that we deal with all the members of that diverse population. The other issue is that this diversity is not random. The older person of 80 years who retains robust health is more likely to be better educated, to come from a more advantaged background, and to have more opportunities as an older person. Whereas the person who is likely to have less robust health and may need care and support is likely to have had a disadvantaged background and have less resources today to be able to call on to help meet their needs. So as we frame a policy response, we need to make sure that we don't just reinforce the inequities that have led to that diversity. Another common misconception is that population ageing is going to send us broke. And often as we look at health systems, people think the increasing demand on health services from older populations will increase costs to a point that we cannot have sustainable systems. In fact, the evidence is that that's not the case. If we look at the United States between 1940 and 1990, a period when there was faster population ageing than is currently occurring, we actually see that only 2% of the increase in healthcare costs across that period were due to population ageing. So while population ageing will have an impact, it's likely to be much less than we expected. And also what we can see is that you can't think about healthcare costs as distinct from other services that older people could draw on. And in many countries where long-term care systems are available, what we see is healthcare costs actually declining after the age of 75 years. And this idea that we're going to be sent broke by older populations starts very much from the idea that expenditure on ageing populations is actually a cost. And so if you think about the various services that older people use, health system, long-term care systems, other forms of social protection and so on, often these are portrayed in the media as a cost. And what people don't really understand is that that's better framed as an investment. And as an investment, we can expect a return. It has benefits for individual older people, ensuring their health, their skills, making sure that they can retain personal dignity. But it also has a return for society, because healthy and able older people not only experience greater well-being, they can participate in the workforce, they can contribute in all the various ways that older people do. And also ensuring that we can look forward to that sort of older age can ensure social cohesion. So the WHO report takes this approach, thinking that investment in health systems and the other actions that are necessary to promote healthy aging actually are investments from which we can expect a very significant return for society. The other misconception is that healthy aging is solely about the absence of disease. In fact, the evidence is that that's not the case. For an older person, it's much more important whether they have the ability to do the things that are important to them or not. For example, I have high blood pressure, but it's well treated, and I like to think of myself as still pretty robust, and I'm certainly able to do most of the things that I would like. It's also a problem to think of health as the absence of disease in terms of how you design health systems, because it means they become very disease-focused, and we tend to respond to individual conditions rather than thinking of the older person as a whole, and that leads to much worse outcomes in the long term. So the report is framed very much around the idea of healthy aging being about how we can build and maintain the functional ability that allows us to do the things that are important. And that enables well-being in older age. The idea of functional ability incorporates two very distinct notions. One is the intrinsic capacity I have inside my skin. My physical and mental capacities, if you like, which are determined by whether I have disease, whether I undertake physical exercise, all the underlying changes that might accompany aging. But whether I can do the things that are important to me, for example, can I sit, is not just determined by my intrinsic capacity. I also need a chair. And it's the same with most of the things in life. And so the things that determine functional ability are not just me, they're also about the environment I live in. What you see here on this figure is how these two trends across life tend to decline, but how if you have a supportive environment, you should be able to maintain the functional ability to do most of the things that are important to you. What we also identify is that there are often three phases of life. There's a period where many of us have high and stable capacity. Then there's a period when capacity starts to fall. And then there might be a period for some where we have significant losses of capacity and are quite limited in what we can achieve and require care and support from other people. Now, the good news is there's things we can do across the life course to change both these trends. So there's things we can do to build intrinsic capacity. When in the early phase of life, when capacity is high and stable, we can make sure we eat well, that we retain physical activity, and have tried to avoid non-communicable diseases. If capacity starts to fall, we can try and build our muscle mass and our balance to make sure that we can retain it for as long as possible. And even when capacity has fallen quite significantly, if services are designed in comprehensive ways, they can have quite a significant impact to slow that decline. But there's also things we can do to ensure that functional ability across life is improved. So, for example, I may be a fit and healthy 80-year-old, but if society doesn't allow me to work, then there's a barrier that prevents my functional ability and achieving the things that are important. We can remove that barrier. If my functioning is starting to decline, living in an environment that's more supportive, perhaps with disabled access public transport, can still allow me to get places I want to go. And if my intrinsic capacity has fallen to a point where I need care and support, providing good care and support can still allow me to have a decent quality of life and to retain the dignity that's the right of every human being. The report identifies 4 key areas for action if we're going to achieve these things. The first is we need to realign health systems to provide integrated and older person-centred health care. At the moment, that's not the way most systems are designed. Most systems respond to independent diseases, and they're often designed to try to cure diseases rather than trying to maintain the functioning of the older person. The second thing we can do is every country needs to establish a system of long-term care. Now, that will be different for every country, and it doesn't necessarily mean that government has to provide most of that care, but it does require leadership, and that leadership can only come from governments. The third thing we can do is think about how can we build age-friendly environments that foster this idea of functional ability, and how can environments that encourage maintaining health, but which also enable people with limitations of capacity to still do the things that are important to them. And the final thing we need to do is to encourage new approaches to research and how we measure healthy aging itself. If we do these things, we can live in a very different world. A world where older people can experience lives that previous generations never had the opportunity to imagine.